Dr. Rich Castellano, the Smile Doctor here at Image Lift. We're here today with Gail. Thank you for letting us share your video today. We're going to be doing a little radius, filler pumping. We've already marked out. We're going to do some of the smile lines, a little bit in the cheeks. Any questions about our goals for today?
No, you've gone over it very well.
Very good. Very good.
Feel
All
very
right.
comfortable.
I've been doing it a few thousand times, so you get the hang of it after a few thousand. I'm going to do a cleanse on the skin for the physicians and students that are watching. I like to use the Hibit cleanse and also a little alcohol swab. So it's very rare that you get an infection from filler, but we still do the cleanse on the skin. There's no restrictions afterwards, and we like to give patients a little bit of ice afterwards, but icing is not mandatory, and sometimes icing can increase swelling if you use a lot of it. It depends on how cold it is, but if it helps, you use a little bit, and then if you feel any firm areas afterwards, you just do a little massage. But most patients say it feels pretty smooth, feels like my normal skin, so that's not a problem. Now, once I cleanse with the alcohol, I like to blot and dry a little bit because if the alcohol is still wet, it can burn a little bit, so you avoid that. And then I use the buzzer, so you'll feel buzz, pinch on 3, 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad. Buzz and pinch, 1, 2, 3, pinch. 1, 2, 3, pinch. Little pinch. Not too bad? You're tough. So Gail, can you share with us? You feel buzz and pinch, 1, 2, 3, pinch. And little pinch, 1, 2, 3, pinch. And little pinch, 1, 2, 3, pinch. Not too bad?
Not
Okay.
at all.
So can you share with us, what was it that inspired you to do a cosmetic treatment?
Well, we'll go back to my oomph.
The oomph,
Just
that's right. We talked about the oomph, right?
Just a lot going on in my life, and I needed to do something for me for a change.
Yeah. So we're going to give her some of that oomph. It does give you that little extra oomph, and that's a good word for it. Because I had a patient tell me, she says, you know, I was not prepared for how good it was going to make me feel. That was the oomph. We call it the oomph. So, okay, so now do you feel a little bit of a pinch here? Not too bad? So I'm just making the little insertion point where we do the cannula, where we place the cannula. The cannula is blunt tip. That makes it safer for you. And really, I think that is the best way to do fillers, with a safety cannula, especially when you're going deep. This is Radius. It's a calcium-based filler. Lasts about a year to a year and a half. And it is a collagen stimulator. So now that I've made the little insertion points, Gail wanted to focus on around the mouth. So I prime the cannula and make sure that the radius is all the way to the tip. I'm going to turn your head just a little bit that way. I find that little pore. It's like finding a tiny little pore. I got really good vision. And I slide subcutaneous for the physicians and students that are watching. I want to put about 2 or 3/10 of a cc in the nasolabial fold of the smile line. Now, we can't get rid of the smile line 100%, and you don't want to, because you want to make sure it looks natural. And every time we smile, it gets a little deeper. So once I injected one area, I'm going to go straight to the other side and inject the other area. We talked to Gail about the ABCs of plastic surgery, and she heard it from me and Stephanie, and getting it in stereo from both of us. Now, ABCs of plastic surgery, when you know the ABCs, you make better decisions and you understand the big picture better. A stands for area. There are 4 areas that we address to improve the appearance. Number 1, if we sag, we tighten. Number 2, if we lose volume, we fill. Number 3, sun damage, wrinkles, and sunspots to the skin. We polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free face-up when we smile. And Gail is a great smiler. She knows the power of smiling. You see how it plumps up the cheeks? So those are our areas that we address to improve our facial appearance, our cosmetic appearance. B stands for boundaries. What are the rules for good plastic surgery? Safety is always first. You must look natural. Number 2. And you will, we guarantee it. Number 3, let's prevent future aging changes. And number 4, let's get as much improvement as possible. Now, we can't make things perfect. We're not God. We do the best we can, and if we need to come back another day and do more, it's better than going too far. And number 4, let's get as much improvement as possible. Right, so we want to make sure that you're safe. You gotta look natural. Let's prevent and let's get as much improvement as possible. Now, of course, we never see for combination treatment. C is combination. If you want your best results, we combine. We combine tightening, volume, and skin. Best results with just one treatment, we talk about lifting and tightening or some laser. Best results, no downtime. Filler. Filler does a great job, but it doesn't give us a lift. In lifting, I get wonderful results, but I can do better when I combine. So understanding combination treatments will allow you to make your best choice. And if you're happy with your result, great. And if you want more, you can either combine or add to what you've done and take the next level. And of course, D stands for different perspectives. We never see ourselves the same way other people do, even though we're looking at the same thing. Because when we look at other people, we look at them socially. But when we look at ourselves, we look at ourselves seriously. And sometimes we're a little hard on ourselves. And we need to be kind. Oh, somebody. Oh, that's okay. No problem.
We like
to be kind
Bob
to
Marley.
ourselves and not go too far. That's what we're going to protect our patients from. I'm just feeling the area, and I like your ringtone.
I do too.
Sorry.
That's okay.
That makes it vibrate.
That's okay. This looks really good. I'm going to do the rest in the cheek, but I want to show Gail what we've done so far. So can you see how we softened through these areas? How does that look so far? I've got a little left. Do you want me to keep going a little down here or a bit in the cheek? Do you have a preference? I'm going to do just a little touch down here and then a tiny bit up top, but down in here. And it's good to get the perspective halfway through so that you know we're on the same page. So a little down here and just a touch in the cheek.
Looks good.
Very good.
Los consultas son gratis. Nosotros estamos locados en Tampa y Los Villages.
This way a little bit. And hablemos español.
Ujú. Y los consultas son gratis. No charge consultations.
Very good. And a little bit here. A little bit here, a little bit there. Very artistic. I've done over 20,000 syringes injection of filler. And most people that are out there injecting, they're usually a beginner. Maybe intermediate at best. But there's really very few advanced injectors out there. They may say they're advanced, but the numbers don't agree.
Now you can't tell your age. You know
Say
that?
again?
I said you can't tell your age.
I can't tell them my age, that's right. I'm 85 years old, but I've done a lot of
Look at
treatment.
his surgery, how great he is.
You're so funny.
That's exactly what they're saying.
We have the best patients. See, I feel like I'm retired, right? I get to do what I love to do, spend time with the people that we enjoy. There's a lot worse people we could be spending time with. So this is a good place to be, and we're honored to be here to be a part. We love to give to the givers. Right? Gail is definitely a giver, giving to others, and today we get to give to Gail. It's called self-love. We all need to give to ourselves. So it is an honor to be a part of this. If the world would be a better place if we had more people like Gail.
Best birthday gift ever.
Oh, you're sweet.
Vivian Rosa says, "You're so funny," and she's watching you from Peru.
Oh, wow. Hello from Peru. So we are completely done. Hopefully that wasn't too bad.
Oh, not bad at all.
So let's take a look. So there's no restrictions. Gail will pass the grocery store test today. You walk into the grocery, nobody does a double take. So we got to plump in through these areas, a little through here. Now, even if we didn't do any injection at all, you'd have a little swelling from passing the cannula. So I like what I see. The swelling's going to settle. The collagen's going to build. And then I would see you, we usually do about 6 to 8 weeks. You can check in. We're going to look at your before and after pictures side by side. We're going to tell you what a great job we did. And if you're happy, you leave it. And if you want to add more, you can always build on it.
Okay.
Any questions?
No, I'm excited to come out and get my lips done.
If you're ready, we're ready for you. So I give you hugs and hugs
Hugs,
and
hugs.
hugs.
Thank you so
Hugs for you two. We're on a mission to stop bad plastic surgery. We want to do it the right way, and we are going to raise your standards. Please share and let others know how they can have it done. It doesn't have to be that. How was it? Was it painful?
much. Not at all.
It
No.
doesn't have to be that painful. If you if you hear someone say, I have fillers, it was so painful, they're not doing it the right way. So, see you in the next video. More videos coming soon. Happy New Year.
Come to the nest.
You did great.